Hello everyone, I am Dr. Piyush and I welcome to my video, and I'm shooting from my clinic itself. So the topic of this video is what is physiotherapy and how it saves our money, right? I think a lot of people are concerned with how physiotherapy is expensive, or it's I can't afford it. There are a lot of reasons to avoid physiotherapy. So I'm going to clear everything in this video. So, what is physiotherapy is? Physiotherapy is a non-medicated treatment, right? Is a non-medicated form of treatment. It involves manual therapies, right? It involves exercises. It involves electrotherapy therapies, right? So, a lot of machines, I would say, right? That would be easy to understand, right? So this is all form of you can see a lot of things in my background. Also there's a ball in my background, there's a mat in my background, right? So we use all similar kind of things for the therapeutic purpose. So physiotherapy works in many different areas. Like, for a lot of people don't understand like physiotherapy is only for one particular thing, right? I would like to add information to this. So physiotherapy works in a variety of cases. So I have divided this. I have divided into categories. First category is of orthopedics. Second category is of neurological conditions or geriatric cases. Third category is of pediatrics. Fourth category is of sports physiotherapy. Okay, so there are a lot more beyond this. I want to cover up all these four branches where we really work. So coming up to the orthopedics, a lot of people do understand physiotherapy works in orthopedic cases, because people have someday they have seen physiotherapists for their neck pain or back pain. Yes, we do treat neck pain and back pain, and there's a number of cases in addition to this we treat them. This involves any joint issues. It can be of your shoulder, it can be of your knee, it can be of your elbow, it can be of your any particular joint, can be even of your finger. So we do treat all of them if it's of muscular origin, right? And along with that, we also work with the surgery patients who have undergone the surgery, orthopedic surgeons, especially the knee replacement cases, hip replacement cases, or any particular joint, even of the shoulder joint. Also, we do work with them. We help them to get back to their normal life, right? So this is about the orthopedic side of physiotherapy, right? And how we save a lot of money, right? We save a lot of money I'm talking about the patient side, right? Patients have a lot of money with physiotherapy, going through physiotherapy, right? We work, we make them get back to their normal routine. Like we are able to reduce their healing time. We are able to reduce their rehabilitation phase, because if someone is not taking a physiotherapy or not taking any rehabilitation services, their healing time or their recovery time can be a longer one. So we as professionals, we as rehabilitation professionals are able to reduce that recovery phase. So if your recovery phase is reduced, you will be able to resume back to your job or your work very soon. So we are able to cut down your sick leave. We are able to increase your working days. We are able to increase your earning potential. This is how we save your money. And also I'm talking about from the preventive side also. Taking physiotherapy also helps you to going through unnecessary hospitalization. It will save you from, on the medicine side, you will require less medication if you go with physiotherapy. And the third one, it also helps you to prevent yourself from unwanted surgeries. So there's a lot of advantages. You need to open your mind to understand how physiotherapy works. Okay, now the second category I'm going to discuss is the neurological physiotherapy, neurological or geriatric physiotherapy. Coming to the neurological physiotherapy, we work with cases like stroke, hemorrhage, spinal injuries, Parkinson's, Alzheimer's, or peripheral nerve injuries, So we do with a lot of cases like this. The road traffic accidents, especially the traumatic brain injuries, this is a very debilitating condition for the person. So, we are able. What is the work of physiotherapist in all these conditions? So that is very important. A lot of people don't understand where the physiotherapy works. So there is a movement loss after one is going through this such kind of condition, because it's connected with your nervous system. One loses his motor power or loses his sensory power. So we do a work to rehabilitate those areas. We work to improve your motor power. We work to improve your sensory awareness. We work on your neuroplasticity. We work you to get back to your movements. We work you to get back to your balance. We work you to get back to your functions like sitting, standing, walking, right? So, and this is the thing we work with neurological patients, right? Director is also similar, but it comes with the old component also, because aging is a part of old age or geriatric group. So for geriatric patients, it's very important for one individual to get when one is old age, like one needs to be taken care of. Nobody wants to get neglected when you are in old age, right? So physiotherapist works with their mobility, especially because mobility is something old age people usually complain about. They have reduced mobility. They're not being able to lift their arm. They're not being able to move their legs or feet due to the pain or due to the stiffness. This is the common complaint by the old age people. So we physiotherapists are able to address such issues. So we are able to get back their mobility. So we do save them on all the same parameters. I have also personally worked with a lot of neurological and geriatric group patients. I have seen them, they save a lot of money on hospitalization, because they don't require long-term hospitalization. They save a lot of money on that side, because hospitalization can be a very expensive affair. Even if you have insurance, if you don't have insurance, it's a really expensive affair, and it's not really easy, right? People undergoing physiotherapy, they save a lot of money on medication side. Even the doctor feels that the patient is improving. They don't add a lot of medications in their medication chart. And lastly, the patient can prevent his unwanted surgeries also. So this is, and along with surgeries, I will not say it is also really peaceful for the family members, caregivers, if the patient is under control or is going well, so they don't have to worry about their patient. So it's also better on the patient care side as well. Now the third category I would like to discuss is about the pediatric, right? Pediatric is about the child, like child physiotherapy. Child, especially one with delayed milestones, right? Or permanent neurological, non-progressive neurological conditions like cerebral palsy. These are two group of patients we usually see. How we work with them, we help them to achieve their milestones. We use a lot of different techniques with our pediatric patients. We use the neurodevelopment therapy with the patients. We use positioning. We use a proprioceptive training. We use constraint-induced movement therapy also. So these are all therapies we use with the pediatric patients. Talking about the saving money point of view, yes, we are able to save a lot of money from the patient side of view, because when your patient or your child is able to achieve certain goal, right, then his quality of life will really improve, right? So his quality of life will really improve, and he will get back to his school or his daily routine, right? So you can save a lot of money, by getting into other medication side or any other thing, right? Because and especially in the pediatric case, you're only concerned with the movements, right? The child should be able to move around, or should able to do his activities, right? Then the last thing, the thing which comes is the sports physiotherapy. Sports physiotherapy is really important because sports come with its own disadvantages. Because when anybody is, you ask anybody, anybody who's in sports, he will talk about he definitely have sometimes any injury. He will definitely will have some injury in his lifetime. And for any sportsman, injury can be a very very negative thing in his life. It will prevent him to perform well in his sports. It can even destroy his sports career also. For any sports person, I'm saying his injuries, the person is really worried about his injuries. And the sports person really wants to get fix his sports injury as soon as possible. So we physiotherapists, have a lot of experience with sports person, and we are able to fix their sports injuries, and we are able to rehabilitate. We are able to strengthen their muscles, joints, so they can get back to their sports activity. Yes, definitely. It's nothing I wanted to add on this, because definitely when you are back to your sports, you are really earning money. So, and if you're not working, or if you're not into sports due to injury, you're definitely losing money. So, I think a lot of people must be are now able to counterbalance the benefits and expenses what you get with physiotherapy, and how you can proceed with this. At the moment I'm kept my services in Sirsa, and right, so you can contact me, right? And if you have any further doubts, you can add in the comments below, or you can directly contact me. I'll be happy to answer all my queries. Thank you. Bye bye. See you next time with some lot of interesting videos. Bye bye.